Good morning. My name is Chinasa Onyeje, a DMP student from Brandman University. Today's presentation is using concepts and theory into implementing innovative changes at the workplace. I put out this handout. It's all about what I'm going to talk about, but it is short and very concise so that you can follow along. What is my CSP project? It is provider education about antibiotic guidelines that would decrease inappropriate antibiotic prescription for patients with upper respiratory tract infection by 25% within 4 weeks. The graph that you see here is a representative of antibiotic resistant pattern of MRSA to different antibiotics from 2013 to 2016. The theoretical model that I chose is Cottle-Lewin's 1947 theoretical model of change. It is based on a 3-steps framework: unfreezing, make needed change, and refreezing. And overview of that theory, it has 3 steps. Step 1, the unfreezing. You unfreeze the current behavior. This step creates awareness of the current unwanted behavior. It uses effective communication to determine thought processes, perceptions, and habits that form the behavior. Step 2, making the needed change. This step uses innovative educational approach to help people transition to the desired behavior during the implementation phase of a change project. Step 3, refreezing the new behavior. This step reinforces what is learned to make the new change stick. This ensures that people do not fall back on their old behavior. The 3 steps will be incorporated into my interventional tool to educate the providers about antibiotic guideline. What is the problem? The problem is that in the United States, more than 50% of outpatient antibiotic prescriptions are inappropriate. Majority, 41% prescribers are medical doctors. Nurse practitioners and physician assistants come second at 23%. Inappropriate antibiotic prescription cause antimicrobial resistance, adverse drug reactions, emergency room visits, and increase in healthcare costs. Infectious diseases rank 4th in USA and 2nd worldwide as the leading cause of death. Methicillin-resistant Staphylococcus aureus, which is MRSA, is the leading cause of 2 million deaths, 360,000 hospitalizations annually, and 20 billion in healthcare costs in the USA. And the graph here indicates exactly what I had just written. The 20 billion cost in healthcare, greater than 10% die, which is 23,000 in the USA alone, and 2 million deaths due to infection, resistant organism. Using the 3-step chain theory by Cottle-Lewin to address health issue. I'm going to use it in my CSP project. The unfreezing stage of the change, which is first step, I will use to detect and evaluate providers' antibiotic prescriptive habit for upper respiratory tract infection. I'll then compare provider prescriptive pattern to evidence-based antibiotics guideline. The second step will be changing or moving to a new level. I will use innovative educational approach to focus on changing providers' thoughts, perceptions, feelings, and behaviors to achieve the goal of appropriate antibiotic prescription based on guideline. Patients' charts will be reviewed to see if there is change in appropriate antibiotic prescription after educational intervention have been implemented. Antibiotics pamphlets will be given to providers to use as patient teaching tool during visits and for inclusion into visit summary for patients. This will promote interactive practitioner-patient visits to elicit patient satisfaction level with treatment plan when antibiotics were not prescribed for URI. Third step, refreezing the new desired behavior. The providers will integrate the CSP project intervention into daily usage and practice as operational standard. Providers' antibiotic prescribing pattern change will be consistently in line with the guideline upon intermittent patient's chart review to reinforce consistency and provide support through the process. Reminders, staff meetings, and recognizing individual efforts are measures that will be utilized. I thank you so much for listening. That is the end of my presentation.